Right, let's just dive straight into this. Today's explainer is unpacking some absolutely paradigm-shifting insights from a recent interview with Dr. Yosef, a former medical officer at the FDA. His revelations about our modern medical system, and specifically how we view and prescribe psychiatric medication, are honestly going to fundamentally challenge what a lot of us thought we knew about mental health. We're going to peel back the curtain on exactly what happens behind the scenes of prescription approvals and see how crucial lifestyle factors are being dangerously overlooked.
I mean, think about this staggering disconnect for a second. Why in the world do we take psychiatric drugs for decades when they are typically only studied for a single year? Dr. Yosef points out this massive gap in the source material. Basically, the clinical research for these medications usually just stops at 12 months, yet patients are routinely prescribed them for 2, 3, or even 20 years. So, what happens after year 1? Well, the truth is, there's a huge amount of uncertainty regarding long-term safety and effectiveness that most patients are completely in the dark about. To truly make sense of all this, we're going to follow a clear roadmap today. 1. The chemical imbalance myth. 2. The 15-minute medicine flaw. 3. The high-potency cannabis danger. 4. The root of chronic stress. And 5. The body-mind-spirit solution. Okay, let's start with section 1, the chemical imbalance myth. Addressing the widely accepted theory of serotonin deficiency, Dr. Yosef states it flat out. He says there is no such thing as a chemical imbalance. We have looked. Now, I know that might be incredibly jarring to hear. The whole serotonin deficiency thing has been accepted as absolute fact by the public for decades, right? But Dr. Yosef explains that researchers have actually tested spinal fluid for serotonin metabolites. They've even conducted autopsies on the brains of depressed individuals. And the result? They found absolutely zero biological markers or serotonin receptors that actually differentiate them from healthy brains.
So, if there isn't a chemical imbalance, how well do these drugs actually work in studies? Well, it all comes down to the number 2. In clinical trials for antidepressants, success is measured using a 52-point scale called the Hamilton Depression Scale. And according to the source data, the medicated group only scores, on average, a mere 2 points better than the placebo group. I mean, 2 points on a 52-point scale is incredibly tiny. And on top of that, for patients under 25, these drugs actually carry boxed warnings because the data shows they increase the likelihood of a suicide attempt during trials.
Which brings us to section 2, the 15-minute medicine flaw.
You're probably wondering, if the data is that slim, why do doctors push this narrative? Well, ideally, psychiatric care involves a thorough, unhurried exploration of a patient's trauma, diet, lifestyle, and relationships. But the 15-minute reality, it's completely different. Dr. Yosef explains that the algorithm-driven insurance model has essentially forced doctors to see up to 4 patients an hour just to keep the lights on. There's literally no time to explore a patient's complex life. Instead, you get a checklist diagnosis followed by an algorithm-based prescription. So this chemical imbalance theory essentially serves as a convenient little white lie to smooth over the fact that doctors just don't have the time to offer comprehensive care. Now, this isn't to say these drugs don't do anything. They absolutely can offer short-term crisis relief. They act almost like a much-needed pause button on severe anxiety or panic in what is, frankly, a highly stressful world. But they just aren't a sustainable long-term fix. The human brain is simply not designed to be in an indefinitely drugged state. Over time, your brain naturally builds a tolerance, the drug effect wears off, and this leads to a trap known as drug stacking. That's when patients end up on 3, 4, or even 5 different medications, which leaves them feeling sluggish, cognitively impaired, and usually experiencing even worse long-term symptoms.
Let's shift gears to section 3, the high-potency cannabis danger.
Okay, you've got to see this dramatic hockey stick increase in THC potency. You know, a lot of people still think of cannabis as this benign, safe herb from the 1970s, back when the average THC concentration was around 3%. But look at today. Hybridized growing and hydroponic fertilizers have pushed THC levels to anywhere between 20 and 35%. Dr. Joseph warns that today's high-potency cannabis is an entirely different, incredibly strong drug, and it is having massive, completely unrecognized psychological consequences.
And here is the truly tragic pipeline playing out in hospitals right now. A patient consumes this modern, high-potency THC and experiences a drug-induced psychosis. Dr. Yosef likens this to a temporary brain injury. It can literally take 3 to 12 months of complete sobriety to heal from it. But because the psychosis outlasts the immediate high, doctors often misdiagnose the patient with lifelong conditions like schizophrenia or bipolar disorder. So the patient gets trapped on heavy antipsychotics, drugs that cause irreversible side effects like tardive dyskinesia. when honestly, all they really needed was time, support, and sobriety to let their injured brain heal. Moving on to Section 4, the root of chronic stress. So, moving from acute psychosis back to the everyday ailments so many of us deal with, we really need to redefine a common issue: insomnia. We usually think of it as purely a nighttime sleep issue, right? But based on the source material, insomnia is actually a daytime hyperarousal problem caused by chronic stress. If your brain is wired to be in a constant go-go-go state all day long, trying to fix it with gimmicks like blue light blocking glasses or playing with the bedroom thermometer is useless. It's literally like bringing a water pistol to a raging fire. So, what is actually fueling this constant hyperarousal? Well, it's our entirely unnatural modern environment. We are constantly slammed by this endless productivity culture and the immense strain of two-income households where there's just zero downtime. Add in the psychological pollution of social media comparison, the total loss of the communal village that used to support families, and a broad societal decline in meaning and faith. When you look at the whole picture, it becomes incredibly clear that feeling anxious or depressed in this high-speed, chaotic world isn't always a biological disease. Often, it's a completely normal reaction to a totally unnatural way of living. Finally, Section 5, the body-mind-spirit solution. So how do we actually escape this medication loop? The source lays out a beautifully holistic framework. For the body, prioritize whole foods, avoid massive sugar spikes from ultra-processed stuff, and try to get 7,000 to 10,000 steps a day to naturally lower inflammation. For the mind, practice breath work or yoga nidra to literally force your nervous system to rest and actively learn distress tolerance skills. And finally, for the spirit, humans need purpose, engaging in meaningful work, building true community, and living a life in service to others. Emphasizing these simple lifestyle and nutritional factors actually heals the brain far more effectively than just relying on a prescription pad. It really highlights a sharp contrast in what we're aiming for here. The medical system often aims to create the stable patient. That's someone who is highly medicated, just sort of surviving the day with subdued emotions and simply staying out of the hospital. But come on, that's not what we actually want as humans. We desire to be the thriving patient, someone who is engaged, physically healthy, experiencing our full, messy range of emotions, and living each day with real, hopeful purpose. Which brings us to a final, really profound thought to leave you with. Are you living a truly thriving life, or are you just medicated enough to remain stable in a chaotic world? It's a huge question, and one that challenges our entire modern definition of mental health and what it actually means to be well. Thanks so much for joining me to unpack this explainer today. Keep asking those great questions, keep seeking to truly thrive out there, and I'll catch you next time.